Hello, everyone. Welcome to the Ohio Council for Home Care and Hospice podcast for August 2025. Thank you for making us part of your day, wherever you're doing that, whenever you're doing that. With me, I have some amazing teammates that are going to contribute to today's hot topics. Of course, I'm Drew Cook, with the Communications Director for the Council, and we have Lisa Von London, our Executive Director. We have Hope Mulliken, one of our expert panels, Cheryl Meister, and Christy Piles, also on the expert panel today. So everybody chime in and say hello.
Hello.
Hey, everybody.
Hello.
Hi, everyone.
Fantastic. I would like to say that it's due to the member support that we can make these podcasts happen. And this podcast is sponsored by ACHC. And we'd like to point out that they are a member benefit. Also, how council members receive a $500 discount off initial and renewal accreditation, as well as $50 off educational resources. So whether you're home health, home care, private duty, or hospice, ACHC delivers personalized guidance, quick answers, and key resources to make the accreditation process stress-free. I know we could all do with some stress-free right now, eh? So I'm going to hand it over to Lisa. Lisa, you have some things to say.
Happy Wednesday, everybody. Stress-free. Drew, come on now. That's crazy talk.
It is.
Yeah, it certainly is. And I say it all the time, but I definitely think you missed your calling. You absolutely have a voice for radio. And although I don't want to lose you in our life, you really should blow the dust off of that at some point. But that's not what we're here to talk about today. Today is our August hot topic. I can't believe it's August already. I was reflecting on the fact that we're heading back to school here in the next couple of weeks. And then that sort of led me into we're heading into September. And with September comes a lot of fun. Not only are we looking at Advocacy Day down in Washington, D.C., which is not an advocacy day this year. It's an advocacy couple of days, as I like to call it. I believe we're looking at the first full week of September. So when we come back from Labor Day, I believe we'll be inviting folks down if they'd like to join the Alliance for advocacy Wednesday, Thursday, Friday, I believe. Drew, if you can find that link and share it in the chat, that would be awesome. It is a little fast and furious because it really butts up against annual conference and trade show. So if you haven't registered yet, please do register for our annual conference and trade show. We have a really dynamic speaker lineup. I know it's been out on all of the social media and out to our listserv and whatnot, but if you've missed it, you can probably go to our LinkedIn page or our web page to take a look at all of the wealth of information that's going to be coming at you from our speakers. I also want to remind everybody, the emails have gone out. Celebrate your colleagues, folks. We do have a list of awards that we provide or present every year at our annual conference and trade show. And it's really an awesome opportunity to put a spotlight on people who go above and beyond in the community to take care of our Ohioans that we love and care for on a daily basis. If you haven't already, please do nominate one of your colleagues or companions, friends, whatever you would like to call them, and get it sent in to us so we can pick some winners and celebrate, the folks who do some of the hardest work out here in Ohio. Let's go backwards for a hot minute. We did have a golf outing on Monday, July the 28th. I would love to tell you more about it, but I ended up only being able to attend a small portion of it at the beginning of the day, just to kind of welcome everybody and kick it off because I was undergoing some emergency dental concerns, which is a great story for another time. If you want to hear it, find me at the annual conference and trade show after a couple glasses of wine because it gets more and more animated every time I tell it. But to all of you who came up to Avon, Ohio, Sunday the 27th and Monday the 28th, I can't thank you enough. We had a beautiful day. It was extremely hot. There were a ton of players out there, and the feedback was absolutely awesome. I'm not going to go on record with this, but I feel pretty confident that we did another probably $15,000 to $18,000 for our state and federal PAC. We actually welcomed Representative Kelly Dieter from the Lakeshore counties. And she was a major champion for us in the budget. So It was a really good day. I thank you all for coming out, and I hope to see you next year, and I hope to actually golf with you next year rather than sit in a dental seat for 3 hours. Cool. I'm not upset about it anymore. Um, okay, what else? Well, let's talk about Kelly Dieter, right? Why is Representative Kelly Dieter a major champion for us? Well, because she was the rookie representative that really put a lot of muscle behind our ask for workforce development. And I am thrilled to say that in the Ohio state budget, the Ohio Council was awarded $2 million over the course of 2 years to invest in student nurses, to work with our member agencies to put student nurses in clinical rotations, internships, externships, and ultimately become hired clinical nurses of those agencies to start a mentorship with each agency. So as the details of this program come out, and as we define the criteria of what it means to be an eligible home care agency for these rotations and ultimately to become employers of these nurses, we will definitely get the information out to you. This is really exciting, folks. I don't know, at least in my recent knowledge, that we've seen an investment quite like this, specifically in workforce. So I'm really excited about it. And then I guess just to kind of finish that off, I'm not sure if anybody's going to be in attendance, but we will be speaking at the Ohio Chamber event tomorrow. My panel begins at 11 o'clock, and we're going to be talking about workforce and the challenges we face in home and community-based services and what all we're doing to meet and face those challenges and how we're getting a little outside of the box. So I plan to take a bit of a deeper dive on this particular topic tomorrow at 11 a.m. at the Ohio Chamber Workforce seminar. So I think that's it for me, unless any of my trusted colleagues have anything that you think I might have missed. If not, today's a travel day, and that's why you don't have to appreciate my lovely mug. So I'm staying behind the LL today and getting back after it in the car. So thank you all for your time, and Drew, back to you.
Fantastic. Thank you, Lisa. And I'll be sharing a couple of the pages and links here in a moment. So yeah, safe travels, Lisa, when you get on the road. I know you'll be with us for the podcast in case you need to add anything.
Thanks, Drew.
And okay, so I think we're back to group mode, or maybe just me spotlighted. We're still figuring out this podcast thing. I've got a few pages to share, and then we're going to get into some amazing updates from our expert panel. Let me just get the browser up here. Okay, I'm going to start off with the Caring Awards. This is what Lisa mentioned. We've been doing this for years. We have a whole bunch of different categories you can nominate your colleagues for. Award of Excellence, Caring, everything is focused on hospice or home health, and homemakers, home health aides. There's a lot here. So submit as many nominations as you feel appropriate. If you know 10 amazing people, that's 10 nominations. Go for it. This can be found on our annual conference page. That's on our website, of course, OCHCH.org, and follow the pictures. I will also mention here is the National Alliance for Care at Home Advocacy Week, September 8 to 11. This is it's going to be a powerhouse of several days there in DC. And I know some of us will be there. So if you plan on going, let us know so we can coordinate, at least catch up for a coffee, see each other in meetings. So that is happening. You do need to register. You can't just show up, as far as I understand. But that's on the National Alliance for Home Care website. That'll also be in our bulletin, our newsletter. If you're seeing this podcast, you probably got the newsletter. That's where you got the link. Our bulletin will have information on this in it. And of course, mentioning ACHC, today's podcast sponsor. I had their page ready to go and totally missed it on the beginning. I will also mention Member Archangel. They are stepping up with 100 free courses for OCHCH members. Wound Assessment Bootcamp. That's 2 CEs. If you want to fill this form out, we'll verify your membership and get you a code to take the course for free. Limit of 100 signups. This will be in the bulletin. The link there will be around until they're all used up. So fantastic. Thanks to Will and the team at Archangel for that. I will mention upgrades to the annual conference and trade show page. We have exhibitor pages. We have so many booths that we had to put it on 2 pages. Go to the annual conference page, check out booths 1 to 36 and 37 to 72. We have some amazing vendors, resources to help your business grow. I don't have time to scroll through everything, but this is what you got. So if you want to know who's at the trade show, this is where to find out. There are still some booths open. If you are a business that wants to exhibit, better jump on it. We have maybe 20, 18 tables left. Just published today, Katie Eisel, Payer Relations Director at OCHN, could not be with us today. Hope is going to be helping assist with some of her content, but I wanted to share this article from her. It's about safety tips on ADRs. Recently, we have had a flood of members asking, is this real? Seems like this is a new target for scammers. They just found out about it or something. But this is a blog post that has amazing safety tips in here. Some of it you've heard before, some of it maybe not. So take a look at this post on our website in the news section and share it with your team, and just make sure you're being safe there digitally, okay? Last thing, Lisa is now on the National Steering Committee for an amazing survey that is going to be working through the rest of the year. They have an initial input field survey is what they're calling it, just like what are the topics you want to talk about, I think. That is happening through the 18th. So again, in the bulletin, you'll see a link to it. And this is the short 3-minute survey that we need everybody to fill out before August 18th. This helps the study folks at Berry Dunn craft the survey to be the best it can be for its full rollout this fall. So that is all I've got. I will stop sharing. So fantastic. And I was going to pass it over to Christy Piles, our EVV expert, who has a brief update for us on EVV and maybe some other things.
Thanks so much, Drew. Welcome to the podcast today. We have been meeting with the Ohio Department of Medicaid weekly now on EVV issues or enhancements requests, and that has been very productive. ODM is a great partner in making sure that everyone can be successful. So one of the things that ODM has told us is that they are seeing some providers who are not using EVV at all, and also having some providers report that they're having issues with some vendors, the alt vendor users. So what we want to put out there is if anyone is having issues with EVV or has questions or are struggling, ODM said reach out to that interagency policy at medicaid.ohio.gov email. And for those who may have issues with their vendors not sending data appropriately to SANData, or maybe your vendor's just not listening to you, please feel free to reach out to us, because this is something that I do on behalf of OCHCH. We'll look at your files and see what's wrong and talk to your vendor if need be. So we want everyone to be successful, and ODM is working very hard to make sure everyone knows what's coming. So if you're a provider who is struggling, please reach out. Or if you know providers who just aren't using EVV or don't know about it, let them know, because this is something that we definitely want everyone to be successful on, because you're getting paid and make sure people get the services that they need. So it's very important that we're all compliant and that we're all doing what we need to do to help each other. And one of the things I also want to mention is we do know that there are some issues that have been reported to us. Thank you so much. We are working with ODM on those issues. So if you happen to discover an issue with SANData, or perhaps your alt vendor is sending data and you're not seeing it in SANData, please reach out to us, because we are having weekly conversations with ODM. Just give us your ticket number and a description of what's happening and how long it's been pending, and we will bring it up to them every week. So it's a teamwork makes the dream work. I'm going to say it every single day. So just reach out. We're here to help you when you need. That's all I've got, Drew.
Fantastic. Thanks, Christy. Everybody got those emails there. And yeah, the help desk, so many folks ready to help there. So Hope, I believe you're up next. Had you on spotlight here.
Thanks, Drew. Hi, everyone. I just have a couple of updates. Katie Eisel isn't able to be on today, so I wanted to address the Pepper reports. So it's not looking like they're going to be released again this year. They've been paused since 2024, and they're usually released in July. So my suggestion is all of you agencies, reach out to your EMR, try to look to see how are you doing operationally. And if you would like more intimate support with this and you're not a member of the OCHN, you might want to try to join, because we can really help you in that area. It's unclear if the Pepper reports will be released. So we'll keep you all updated and let you know how that's going. The link that was put out by CMS for questions for the deadline of 8/19 of 25. It's not functional right now. So if you have any questions, you can always reach out to us as well. The other update is about the quality improvement and evaluation system. This is being upgraded. So the outcomes for the patient evaluation, the HOPE assessment, that that functionality will be launched in ACHCS on October 1st of 2025. And ACHCS will require a new user management system. And you can go on here and create the account through the HARP system. So if you have any questions with that too, you can always feel free to reach out. And I think that's all I have. Thanks, Drew.
Okay, excellent. That was a great update. Thank you. And your Wi-Fi slowed down for just a second to make that date really dramatic sounding. It was good. That was
Oh,
fantastic.
sorry.
No, it was good. All right, so we have our next block of updates is from Cheryl. Cheryl, you have the floor.
Thanks, Drew. Hello, everybody. The last month or so, I've had the opportunity to welcome an Ohio Department of Health surveyor into two of my offices for a recertification survey. And I just thought I'd bring to your attention some of the things that they're requesting. They first of all want an unduplicated census times 12 months. They want the client roster and they want your HR roster. When they get those, they want you to plan the visits. So they're going to ask you, depending on what your census is, they're going to ask you for 4 visits, 5 visits, 6 visits, again, depending on your census. I recommend that you know ahead of time who you're going to send them to, what patient and what staff. Know your clients, know your staff, and know that they've been prepared for when the surveyor walks in the door. So that's my tidbit on planning your visits. They're going to want the current 485 or plan of care for the clients that they're visiting. They're going to want the HR files for the staff that they've seen on these visits. And for both of the visits that I had this time, their focus was on the licenses for the staff, the orientation that the staff had when they were hired, and the skills checks. They're going to look at the visit notes for the clients that they went to see. And they're going to make sure that the nurse or the home health aide is following the interventions on that 485. And they're also checking the frequency that's on the 485. So have your missed visits ready if they have had missed visits. They're going to want the med profiles for those patients. We know, of course, that they look at all of the meds that the patient is on and make sure that it matches what's on the med profile and the meds that are in their home. They're going to ask for brochures or patient handbooks or admission documents that your nurses gives to a person when they do a start of care. They want your CLIA certification. They're going to ask for discharges, and this time they focused on the discharge summary. They want BCI logs, and that's different this year, and I believe it's different because they're also doing licensure when they come. So they did ask for the BCI log, and the BCI policy that you have for your company, they also request. They're going to look at your complaint log. Only give them the log. They need to ask you if they want to delve deeper. So just give them the log. Don't give them your investigation of the complaint or your resolution of the complaint. Just give them the log. They'll want your org chart. They're also looking for the OASIS validation and submission. They're looking for late submissions for OASIS. Remember, when we were providing services during COVID, we had a break from submitting every 30 days, but there's no longer that break. So they are looking for late submissions. The policies they requested of our 2 offices were home health aide supervision, LPN supervision. I mentioned before the criminal background check. They want to see the org chart. Something that was different this year, EDP, or Emergency Disaster Planning, that's being done by a group of firemen who the Ohio Department of Health has consulted with. I guess they feel that these firemen have a better experiences, better knowledge of reading emergency disaster plans. So that's why these firemen are doing this now and not the staff for the Ohio Department of Health, not the surveyor themselves. So you'll be asked to send one of these firemen a list of things, and the things that he requests is, of course, your EDP plan. They want to see the hazard vulnerability analysis. They want to see employee orientation. They want to see any activations of an actual event or a drill, and then they want to see your evaluation of that activation. They want to see proof that your governing body was informed when something was activated. They want to see proof that your staff and your clients were called during this activation. And they also want to see your resource lists for every county that your agency provides services to. So in a nutshell, that's what they were requesting this time for the recertification survey. And I wish you luck. And I will tell you that my 2 offices only had 1 citation each, and they were very minor citations. So good luck to you all. That's it, Drew.
Thank you, Cheryl. Now, a question on that real quick. Do you think from your experience that this round was more or less daunting / detailed grueling than in the past? Or is it kind of kept steady, with the exception of adding the firemen, for example? But
Um, I think that these 2 surveys, they were still looking at things that they've looked at in the past, but I've been through a lot of surveys, and I also do mock surveys for our offices, so I'm familiar with what they're asking. But I do know if you have, when they ask you for something and you give it to them within 20 or 25 minutes, they're going to be kinder to you. They're going to know that you're on the ball. So try to have all of this stuff together before that surveyor walks into your office.
And how common is it for an agency to do mock surveys throughout the year or at whatever intervals are appropriate? Is that something that if a member is watching this podcast and saying, we've never done a mock survey, that's fascinating. Is that something that is fairly common or?
I don't really know how common it is. It's common for our agency. I've been doing these mocks for probably 5 or 6 years, and it allows us to see our staff's documentation, look at things that I know that the surveyor is going to look at, and it helps us find trends in our offices that we can also associate with QAPI. And it also allows us to see if there's new processes that we need to come up with for our company. So it's been very productive and good for us. So I would recommend that all offices do mock surveys if you have the staff that can do it. It's very beneficial to the company.
Well, great. And I see Hope nodding her head too. I think you got some agreement going there. So I'm going to we're going to stop spotlighting one more piece here. I just realized that I wanted to share one last little bit of note before we wrap it up today. And get the window. Let me find the window. Expert panel updates. Yes, as you know, we have Hope, Christy, and Cheryl today from our expert panel. And if you don't know about the expert panel, go to our website and you can see information about all of our experts. And we just added a new one. Katie Bryan, longtime member and board member, is joining us to contribute to our hospice, the hospice questions that come through our help desk. So we want to thank Katie for getting on here with us. And this is a great group of people. And yes, last bit of housekeeping for members. You've got an email from me, and the deadline is next week, so it's okay. But I need you to check your information. We're working on the updated referral guide, as well as some updates to our online searchable resource directory here. This is something that the public sees when they're looking for a provider. This is where providers try to find each other or other resources. So all I need you to do is find that email first, or reach out to me, but also just go into this provider and service search and just search on your name. And then just pull it up and just make sure that the address is right, that the contact information is correct, that there's a description, there's a logo. That's all we're doing right now. It's pretty simple, but it's really important. So we want to make sure that we're putting your best face forward in our materials. So thank you for that. All right, so I think that is all of my updates. Does anybody else have anything before we wrap it up today? All right, I'm getting everybody back on screen slowly. And I will edit this a bit, I think. Anyway, thank you, everybody. This has been fantastic. Thank you for watching. Thank you for being members and being so supportive. To my team here on the webinar podcast, thank you for being here and for all your excellent updates. We'll see you when we see you. Thanks, everybody. Bye.